Welcome back to Left, Labor Education for Today. And as of the publishing of this video, we're only hours away from what could be the largest healthcare worker strike in US history. We're talking about Kaiser Permanente, a nonprofit healthcare provider serving 13 million patients across 39 hospitals and 600 medical offices across 8 states and Washington, D.C. Tomorrow morning on Wednesday, October 4th, over 75,000 union-represented workers at Kaiser Permanente are poised to go on strike after the company failed to reach a tentative agreement with the coalition of Kaiser Permanente unions by the contract expiration date of September 30th. These are medical assistants, surgical and lab technicians, pharmacists, and administrative staff, among other healthcare workers. On October 1st, one day following that contract expiration, Kaiser Permanente released what they're referring to as their enhanced offer, which reflects increases in minimum wages for all new employees, as well as annual percentage increases for all union-represented employees. However, the company says that the union seems committed to participating in its planned work stoppage starting on October 4th. Meanwhile, the union says that short staffing, which is a long-standing problem across the healthcare sector, has led to unsafe patient wait times, as well as deteriorating level of care across Kaiser facilities. And the union says that the only way to stop this is by improving wages and benefits for workers to be able to attract additional talent. And the union does not believe that the current offers released by Kaiser go far enough to do so.
We would not come and ask Kaiser Permanente to give us better staffing, increase staffing. If you are already at market value, it would be attractive. I worked for this company for 26 years, and we're in the worst state of staffing that I've ever seen.
The coalition of Kaiser Permanente unions has not gone on strike for over 25 years. So how exactly did we get here? Susanna Vogel of healthcaredive.com put together an interesting piece after speaking with over a dozen union leaders, labor relations professionals, and former Kaiser Permanente consultants. Vogel speculates that Kaiser Permanente has sustained multiple decades of labor prosperity because of a unique labor management partnership between union leadership and company leadership, including sharing of financial information ahead of negotiations, as well as requesting input from rank and file union-represented Kaiser Permanente employees, and also a shared understanding about what the mission of the company should be and how that can benefit employees and patients alike. This partnership would result in successful collective bargaining efforts, with contracts often ratified well in advance of the anticipated contract expiration. Here's a video summarizing that partnership from 2017.
After a decade of strikes and discontent, an unlikely agreement changed the delivery of healthcare at Kaiser Permanente. Now, a labor management partnership unites more than 150,000 managers, physicians, and union members together to lead teams, solve problems, and make decisions. Employees of all ranks have a voice in the way the organization delivers care. They've been doing it for 20 years, and it works.
Kaiser Permanente works with 28 different unions to provide good pay and benefits, but also educational programs and avenues for employees to help improve quality and care throughout the company, which is why they're considered one of the premier health organizations in the country.
What better place than to go to the people that are actually delivering the care before you get into the room? The people that are doing the work get a chance to say, we can do it better, we can do it better, here's how.
For the last few years, however, that partnership has become strained, with some critics arguing that this is related to the unexpected passing of Kaiser Permanente CEO Bernard Tyson back in 2019. Union members said this was quickly reflected in the tone of collective bargaining negotiations in 2019, and it hasn't gotten much better since. More recently, unions have criticized Kaiser's decision to acquire Geisinger earlier in 2023, a non-unionized health system, to form a new nonprofit called Rysant Health. And Caroline Lucas, the executive director for the coalition of Kaiser Permanente unions, had this to say: if Kaiser's future growth strategy is a non-union, non-partnership environment, it definitely calls to question their commitment to us. Others attribute the strain in the partnership to the political positioning of the unions, which started back in 2018 after all Kaiser Permanente unionized employees were split up into two groups: the coalition of Kaiser Permanente unions, which is in negotiations right now, and the Alliance of Healthcare Unions, which completed negotiations most recently in 2021. This left Kaiser with the difficult task of negotiating two separate collective bargaining agreements while maintaining positive labor relations with two separate organizations. And this was only made more difficult recently by infighting within each of those individual unions, such as with the United Food and Commercial Workers Local 555, which even requested to leave the National Bargaining Coalition last month in September, citing that their members were not getting the attention that they deserved. And while some blame the company and some blame the union, it's also possible that neither party has as much to do with the deterioration in working conditions or the labor management relationship as the COVID pandemic. Massive increases in safety risks for employees, unavoidable staffing shortages, high levels of burnout, and a devastating amount of disease and death is enough to put a strain on any labor management relationship. And so regardless of the history or the reasoning, Kaiser Permanente workers are without a doubt on the precipice of the largest healthcare worker strike in US history.
We asked you all, don't make us do this, because we know the impact on the patient. But here we are, hours away from a strike.
The coalition of Kaiser Permanente unions has accused the company of bargaining in bad faith, which would be an unfair labor practice under the National Labor Relations Act. However, this is often a tactic that's employed by unions in order to justify an unfair labor practice strike, which would allow these employees to participate in a work stoppage without the risk of being permanently replaced by their employer. And Kaiser Permanente leadership certainly sees it differently, arguing that they will continue to remain committed to negotiating in good faith with the unions to continue to provide best-in-class wages and benefits to all of its workers. And should a strike occur, Kaiser has said that it will continue to take care of patients, leaving hospitals and emergency departments open. However, it may reschedule non-emergency or elective procedures on a case-by-case basis in some locations. In collective bargaining, often a deadline can help facilitate a deal getting done at the 11th hour. However, if that's not the case, we can expect to see Kaiser Permanente healthcare workers on those picket lines starting tomorrow morning at 6 a.m. Thanks for watching this bargaining update. I hope you enjoyed it. I hope you learned something, and I hope to see you in the next video. Take care.